Would you mind giving us a brief outline for clinicians of what you think will be happening in the future?
Yes, sure. I think there is some great developments in the area of periodontal regeneration. I think the direction that it's heading in is very much around the concept of trying to control what happens within the defect. Until now we've used procedures which have treated the whole defect as a single entity, if you like, but we know that the periodontal or the periodontium is a very complex organ. It's got multiple components, and techniques we have at the moment don't allow for control over the healing within the core of the defect. And I think we've got the opportunity now with new technologies to exert greater control over when and where different cells and tissues populate the core of the defect, so we can improve the creation of a new attachment between new bone, ligament and cementum. We're controlling different aspects of the healing process in the right time, at the right place.
Does the technology have to change the mindset of the clinician?
Look, yes, to some extent, but I think the surgical techniques, we've made great advances in surgical techniques. There's so many great contributors in this area, master clinicians that really worked on amazing approaches to the surgical component, but at the end of the day, the material that they work with is pretty much set. So the mindset from a clinical point of view will kind of be similar. You're still going to use the same clinical approaches, but the material we're going to use to place into the defect is going to be the game changer, I think, if you like. It's where the greatest amount of benefits can be gained right now.
So much more comfortable.
Yes, yeah. It's better control over the healing. So
better for the patient.
It's better for patients, absolutely. Yeah. Better regeneration, better clinical outcomes, more predictable regeneration.